The Children's Board of Hillsborough County
is an agency dedicated
to investing in programs
and services benefiting children and their families.
Thank you for joining us. I'm Joanna, Cheshire, Public Affairs Director for the Children's Board of Hillsborough County, and I'm sitting here with two people from the Crisis Center of Tampa Bay. I've got Debra Harris, Director of 211 and Suicide Prevention Services. Welcome, Debra.
Thank you.
And I'm sitting here also with Kristin Selzer, CDI Program Coordinator, 211 and Suicide Prevention Services. Welcome, Kristin.
Thank you.
Thanks for joining me. So let's just start by you guys giving me an overview of the Crisis Center of Tampa Bay from your own eyes.
Crisis Center of Tampa Bay is the community's hub for help, hope, and healing. We've been in this community for over 40 years, providing services anywhere ranging from therapy to advocacy to support, and of course the 24/7 call-in hotline, and now 211. So we've been around a long time. We have an ambulance service that also provides basic life support, transportation, and we are the first stop for help when you've run into a crisis, whether it's trauma related or not. Crisis Center of Tampa Bay, our light's always on.
That's well put. Kristin, what about from your angle?
The thing I love the most about it is it seems to be really focused towards preventative care and also, open care for anybody who needs it. My background comes in inpatient psychiatry, so I unfortunately saw the kids who had already gone through horrible crisis, attempted suicide, attempted homicide, so I didn't get to see the preventative part. So for me, I just love that there's, a hotline out there and help out there for people before they get to the point of really hurting themselves or someone else.
So what is the challenge? 211, it seems like you guys do so much for the community, and you're here and you've been here for a while, and it sounds like anyone can call 211 for a plethora of reasons. So is it hard to get the word out that you are here to help? Because it's almost like if they don't know what they don't know.
And that's absolutely true, Joanna. We talk about how we're the community's best kept secret, and we really don't want to be. But we try to get the word out through avenues like this, word of mouth. Of course, we do some marketing. People who call us, who use us, whether it's 211 or other services of the Crisis Center, they're our biggest ambassadors, our biggest referral source. But again, unless you are in that crisis or in that moment where you want someone to sit with you through that crisis, sit with you on the dark side of pain, hurt, despair, you don't know who to call. But once you're there and someone's linked you to or connected to us, then you make certain to share that with others. So however we can get the word out, we should be a public utility. Everyone should know us. It doesn't have to be about suicide or financial crisis or counseling even. It's just if you're new to the community, you don't know the services available, whether it's health, human services, don't pick up the yellow pages, just call 211.
That's great. Will they get a live person to talk to after calling 211?
Absolutely. 24 hours a day, 7 days a week. Our intervention specialists are there live to talk with you, talk about what's going on, what had you call today, and how we can get you linked to other services in the community, not just the Crisis Center, but to help you move you forward.
That's great. Now, I know both of you work with suicide prevention services. Is that a major part of your job? And also, can you talk about, is that a big issue in Hillsborough County?
Suicide prevention runs under everything we do at the Crisis Center of Tampa Bay, because although folks come through many doors and many avenues with a myriad of presenting issues, oftentimes we find folks are hurting to the point of despair. And so we train all of our specialists All of our staff in 211 and suicide prevention is trained in that intervention and prevention, those techniques. Because especially we noticed around 2008, 2009, the economy crashing and other issues coming out of that folks did present with regular basic needs. I don't have food. I don't have housing. I can't keep the lights on. And when you think about those in a holistic way, those folks are suffering because oftentimes they were calling with kids. So what parent wouldn't feel some measure of despair when calling and can't feed their kids, or we're living out of my car? And then that conversation turns to, honestly, you're my last call, my last hope. And when we ask the question sometimes, say, so talk to me about what that means. Well, if you can't help me, then I think I'm just going to end it. So what do? What do we do at 211? We sit with you. We let you tell us about how dark it's gotten. And we let you move your way through to the light. We just help folks move through to the light. We sit with folks.
So the people sitting with the folks, are they, obviously they're trained clinically, or are those, counselors?
Well, they come to us from a number of backgrounds. It may be clinical, non-clinical, but you're still going to get the specialty subset training around suicide intervention. We have special certified trainers that will take you through that training. And once we're done with that, it's just about getting some practical experience and use on the phone, of course, with the support of veteran staff and supervisors as you start to take calls and talk with folks and help folks work through their issues. But we absolutely give everyone the same training regardless of their background or how they come to us, clinical or non-clinical.
So how does the Crisis Center of Tampa Bay partner with the Children's Board of Hillsborough County?
The Children's Board actually funds the Child Development Infoline, which is my department, and we get some of our calls from 211, the suicide prevention line. We also just have a direct number that you can call. It's 813-946, correct?
For Child Development Infoline, and the number is 813-425-GROW.
Yes. Sorry, I'm still kind of confused on the numbers. So we do have that line, and we do developmental screenings for children birth to 5. So people can call in if they have questions about how their children are developing. We do an initial screening. We can refer out to programs to help carry that child through if they're having some struggles. And we keep up about once a week just to make sure that you're getting all the services you need. And then we provide a re-screen at the 2-month mark to see how they've progressed. So this is a program that is funded completely by the Children's Board, so we're very thankful for that, and we have been able to help a lot of families through that line.
And as Kristin said, the Child Development Infoline is the newest partnership with the Children's Board. The Crisis Center of Tampa Bay has partnered with the Children's Board for a number of years, over 2 decades, back when the Children's Board supported our therapy center, all the way up and through the burgeoning life of 211 out of Hotline of Hillsborough, worked in partnership with Children's Board and other community service providers around the Think Kids project and Kids Connection. So we've really been a partner with Children's Board, helping to be that gateway, providing a seamless system of care for early childhood for a very long time in Hillsborough County.
That's well said. Kristin, are the screenings in person, or is this over the phone, like when I call?
Whatever you're more comfortable with. We can do it over the phone. If you'd rather come in person, that is fine. You can meet at your home, or you can come into one of our offices, and we can do it face-to-face.
Sure. Is one better than the other?
Not necessarily. It's really whatever the family is comfortable with. Some families feel comfortable being over the phone. The questions are pretty general to the point where if your child can do certain things. They aren't confusing questions, which is very nice. So you could ideally do it over the phone. However, it is nice to see the children face to face as well, to have that kind of connection. So we love seeing the kids and the families in person. But like I said, if you'd rather do it over the phone, that's totally fine. Either way.
That's great. And is there any cost involved? And let's say I call, and the call is free.
Yes.
But if I bring my child up for a screening in person, would there be any costs involved with that?
Absolutely not. Our services are completely free.
So I would love to hear of a success story about your work with the Crisis Center from both of you.
There are so many. I think with the Child Development Infoline, the biggest thing is obviously helping the kids who start out being behind developmentally and kind of seeing the progression. Along with that, we've had several families who initially call with questions about their child's development, but through our work with them, we find that they have a lot of other things that they need help with. And with the Crisis Center having so many programs to help families, we're able to kind of connect them to other services. We had a family recently who initially called for one of their children, and when we sent one of our care coordinators to meet the family at their home, she noticed that they had several more needs that they needed just at their home. And with one of their other children, didn't have a lot of clothes to wear, and they were having a hard time finding food for Thanksgiving. So she was able to kind of observe these things when she was over just initially to meet the family. So she was actually able to connect them to getting help with getting a turkey for Thanksgiving dinner. She gave them everything they needed to know for Toys for Tots. And the mother had been through some domestic violence issues. So she was also able to connect her through part of our family stabilization and part of our Corbett Trauma Center. So the mother was able to get help, and the child who initially had the developmental concerns was able to get pretty much right on par for where he was supposed to be when it came time for the 2-month follow-up. So he was able to catch up as well. So that's one of the most recent success stories that stands out in my mind, because we were able to help the mother as well.
That's great. Deborah, do you have anything that sticks out in your mind?
Well, almost every, I think, call to the CDI is, to me, a success story when we're able to connect parents and or caregivers to additional concrete supports they didn't have, other resources in the community. One story in particular that came to mind that I actually shared with our board about 2 months ago had to do with linkages, because that's really what telephone access and care coordination is all about. In the bigger scheme of things, is we're here to link families, concerned persons, caregivers of young children to other long-term or more evaluative services in the community. So a young mother called into our CDI and was she actually called into 211, my apologies, and was connected to one of our care coordinators. And she had a very young child, and then she had 2 more children under the age of 5. And she was concerned about her middle daughter's speech. And so the care coordinator helped her through ages and stages. That's the questionnaire we use for development. And decided that, there are some serious concerns with more than just speech. And so as she began to interact with the care coordinator, other things came out as far as some behavior, some underlying trauma. And so as our care coordinator worked over time to connect the caller and the young mother with a service provider in the community, sometimes, unfortunately, more than we like, we run into waiting lists for those involved services, those deeper end clinical services. So another great part of CDI and care coordination is that we're able to stay with those families and plug them into some other supports and parent groups and do activities to help pass the time and also help plug some developmental gaps as we wait for those linkages. So the parent shared with us, after she was eventually linked to that service provider and received the help that she needed for her daughter, that she was just glad that we were there. She was very afraid, frightened for her daughter. She thought she was doing a terrible job as a parent, and she couldn't thank us enough for just being there to support her. So that's always good to hear that from parents, because that's what we're here for. You know, you're not there alone. You don't have to do it alone. And we're here 24 hours a day, and we can help you work through the human services maze that you face.
Are there any opportunities for the community to learn more about the Crisis Center of Tampa Bay?
Oh, there are plenty of opportunities in different ways. You don't have to volunteer, but I'll put a plug in for that later. Right now, we do what we call We Do tours. And once a week, you can come in for a tour during lunchtime. You can check us out at www.crisiscenter.com and find out more information about how you sign up for a tour. We'll give you a little light lunch, and we'll let you talk with hopefully a client who will tell their story about their interaction with the Crisis Center. We'll walk you around the Crisis Center so you can see all the different services up under the umbrella and see us in action about how we serve the community 24 hours a day here in Hillsborough.
And you're more than welcome to make that plug for volunteers now.
Yes, we have quite a few volunteer opportunities, including in our 211 and suicide prevention services area. Again, you can check us out on www.crisiscenter.com. We have a volunteers page. It'll let you know what volunteer opportunities are available. We also work with some of the local universities and colleges. We do have some internships in the different service areas. We have Women in Action. They are a very involved, robust group of women in Hillsborough County who are committed to raising funds to support client services, what we do. So everything they raise goes back into client services so we can serve more people. So just check us out, find out what you can do from a little time to a lot of time. We have something for you.
That's great. And Kristin, tell us a little bit more about just kind of a day-to-day and what you do.
Well, I'm a program coordinator, so right now I'm just working with the care coordinators, kind of making sure they have everything they need to do their job for the families.
The care coordinators are the people that I may talk to when I call them.
Yes,
okay.
Exactly. I also work with a lot of networking, really trying to get the word out about our program, outreach. We're working on getting all of our marketing set up. So really, I'm kind of here for the care coordinators, here for the families, making sure all of those interactions go smoothly, making sure, the families and the care coordinators have everything they need, along with the networking and really trying to get the word out there.
So I'm trying to put in perspective, it's the Crisis Center of Tampa Bay. So what counties does that encapsulate?
Well, for our primary county of residence, and especially for the CDI, we serve Hillsborough County primarily. But other service areas go into Pasco County for services. Actually, 211, we handle the statewide substance abuse hotline. So we take calls from all over the state regarding substance abuse issues, where to go to get help for that on behalf of SAMHSA. So we have quite an expansive arm, but for the Child Development Infoline services, we are targeting Hillsborough County residents.
Okay. Is there anything that we didn't cover that you'd like to highlight about the Crisis Center?
We rock.
And roll.
Are there, one question I just thought of, how many people are on your team? You said the care coordinators. I'm trying to put that in perspective with the Tampa Bay aspect. I mean, I'm trying to picture, are there people calling, is the phone ringing off the hook, or how many people does it take to really man that?
Well, we have 4 care coordinators right now, and we get a lot of our clients through 211, but we have been getting a lot of calls. We're hoping for more. So as I said before, we have our own line that you can call. You don't have to go through 211. So that our own line is 813-425-GROW, and that's the number we have that you can call directly in to talk to one of the care coordinators. So right now we have 4. We will maybe be bringing more on once we get everything up and running, and we're definitely ready to take in calls for sure.
And just to put in perspective the staffing ratio, the Help Me Grow initiative, which is the larger national initiative, which has brought to the state of Florida and primarily Hillsborough and Miami-Dade counties so far here in Florida, the Child Development Infoline components and of this early childhood system. We are light years ahead in Hillsborough County with regards to staffing this initiative. 4 full-time care coordinators staffed in targeted neighborhoods in some respects, East Tampa, West Tampa, and then right out of the Crisis Center's office as well to handle the calls from folks. In addition to the families who actually need ongoing care coordination, our care coordinators along with our intervention specialists will probably touch over 2,000 families just to see how things are going, to touch base with the concerns, and to help alleviate some anxiety. And say, you know what, your child's on track for right now. And thanks for calling, and do remember us, down the road, because as we know, screening, developmental screening for young children is an ongoing process. And so what's okay today may not be okay 2 or 3 months from now. So right now we're pretty well staffed proportionately to the demand or the probability of calls. So we'll see how it looks. We're always about looking at the information, the data, where folks are calling us from, the times of day to see if we're staffed. But right now I think we're pretty well staffed for this size program.
That's great. Well, thank you. That's a wealth of information about the Crisis Center of Tampa Bay and specifically 211 and suicide prevention services. I want to thank Debra Harris and Kristin Selzer for being my guests today. Thank you for joining me.
Thank you for having us. This has been fun.
It has been fun. Thank you.
All right. This is Joanna, Cheshire, Public Affairs Director for the Children's Board of Hillsborough County. Thank you, Crisis Center of Tampa Bay.
If you would like more information, visit childrensboard.org or call 813-229-2884.